With the start of a new year comes the beginning of dry January, a period when people cut out alcohol for the month to start the new year off on the right foot.
Yeah, but what exactly does that mean for your body? Well, our medical expert, Dr. Payal Kohli, joins us this morning to break it all down. Dr. Kohli, good morning.
Good morning.
So what exactly are the physical health benefits of doing something like dry January?
You know, it's incredible. There was a study in the British Medical Journal where almost 100 adults gave up alcohol for a month. And within a month, they lost 4.5 pounds.
Whoa.
They had a lower blood pressure. They had less markers of insulin resistance. And even some of the cancer-causing growth factors actually went down.
Okay.
Now, if that's not enough for you, you can actually have physical benefits as well in your appearance. So your skin looks a little bit better because alcohol is very dehydrating.
Did you see Jordan just look at me? Did you see this?
Because I'm doing dry January and Corey's making fun of me.
No way I would do it.
So it's really very incredible. And then the list goes on and on, even sexual health, your immune system, all types of things actually benefit.
And that's just for 1 month. Imagine if you kind of kept that going beyond.
That's right. But the impacts of that month actually do have what's called a legacy effect. They last for the rest of the year because they change your behavior over the rest of the year. But to your point, if you stop drinking altogether for the rest of the year, it would really be an exponential benefit.
See, that was my question is, I know some people who do dry January and then once February starts, they're like, I did it for a month, I'm going all in now. You know, it's not like they ease in slowly or they taper it back in. So in the end, it actually still does make sense to do dry January because it changes all the long term as well.
It does. And so what the studies tell us, if we go dry for January, it actually changes some of our triggers and also changes our alcohol tolerance. So that kind of benefit we get from drinking alcohol or the happy, relaxed feeling we get can actually be triggered with lower amounts of alcohol. So if you look at the studies, people who do dry January, even 6 months later, are drinking less than they were drinking if they didn't actually do dry January. Now, if you go back to drinking exactly the same or more, you're probably going to erase a lot of those health benefits. But we do think it creates some sort of behavioral changes because you start to understand your triggers, you start to understand why you drink, and most importantly, guys, you get back that control, right? And for us, I feel like control is one of the most important things. So you don't say, I can't drink, you say, I choose not to drink.
Yeah.
So you really get back control on some of your behaviors that are not so healthy for you.
Yeah, absolutely. You know, when thinking about this, just curious, if you are going to introduce alcohol back into your life after January, is there a healthy way to do that so that, like Corey mentioned, you're not just going all back in the way you did maybe on New Year's Eve?
So one thing you shouldn't do is rebound, right? And say, oh my gosh, I went dry for a month and now I'm going to party and hit it hard, because that's actually counterproductive.
Right.
What you should do is try to understand the benefits. And for a lot of people, they feel so good when they don't drink that it's almost an auto sort of introduction. They feel like, okay, maybe I don't want to drink quite as much anymore. But you want to slowly introduce the alcohol. Look at the dose of alcohol that you're taking. So the number of times you drink and the number of drinks you drink in one setting, and really try to understand if you do need to still drink that much to get the same effects. And then what types of alcohol? Because a lot of people, when they go completely dry, they can start to think, maybe I can drink alcoholic drinks with less alcohol content rather than the hard drinks, which can hit you harder.
Yeah.
It's all great information because I feel like dry January has become very popular. A lot of people do it. And so it sounds like even if you choose to do it for a month, it's worth it because it can change kind of habits down the road.
Very much worth it, and you psychologically feel a lot better. So if you look at people who go dry for January, their mood is better, they're less irritable, they sleep a lot better, which actually makes them a little happier. Now, if you're somebody who used to drink a lot of drinks, going completely dry in the beginning can have a little bit of a withdrawal effect. So that's usually more than 5 drinks in one setting for somebody who could do that before. You don't want to go completely dry in January. You maybe want to do 1 or 2 drinks. So even a little bit less alcohol than before can help you have some of those benefits. So if you're not somebody who can say, okay, I can completely quit it, you can just cut it down.
What do those symptoms look like as we're talking about withdrawal?
So, for kind of minor withdrawal, it's more just like a fast heart rate, a little bit more irritable, a little bit of a short fuse, a little bit more angry. But in the severe cases, if you've been dependent on alcohol for some time, you definitely don't want to stop suddenly without talking to your doctor, because you could even have a coma or a seizure as you withdraw from the alcohol. So if you drink every day and you drink 4 to 5 drinks in a setting, you want to talk to a healthcare professional before you decide to completely go dry.
Yeah. Dr. Kohli, appreciate you coming in. Thank you. Let's